Welcome to BeConnected Support Services Dementia in Individuals with Developmental Disabilities training. Why are we discussing this topic? Because individuals with disabilities are now living longer, dementia rates in this population has seen a significant increase. Throughout this course, we will be discussing what dementia is, the preventable and non-preventable risk factors, what a baseline is, what the signs of dementia are, how to provide support to individuals diagnosed with dementia, and how dementia progresses. What is dementia? Dementia is an umbrella term for a set of symptoms that are caused by disorders affecting the brain. Symptoms may include memory loss and difficulties with thinking, problem solving, or language which is severe enough to reduce a person's ability to perform everyday activities. A person with dementia may also experience changes in mood or behavior. Dementia is a progressive disease, which means that the symptoms will gradually get worse as the brain cells become more damaged. Dementia is not a specific disease, rather many diseases can cause dementia, the most common being Alzheimer's disease and vascular dementia caused by strokes. Some of the other causes of dementia include Lewy body disease, head trauma, frontotemporal dementia, Parkinson's disease, and Huntington's disease. These conditions can have similar and overlapping symptoms. All dementias go through 3 stages: early, middle, and late. If an individual is suffering from short-term memory loss or slowed thinking, but they do not fit into a diagnosis of dementia, it is called mild cognitive impairment. Individuals with mild cognitive impairment are at an increased risk for dementia. However, it is important to note that not all individuals with mild cognitive impairment will develop dementia. What are the preventable risk factors of dementia? Cardiovascular risk factors are also risk factors for dementia. High blood pressure, high cholesterol, obesity, smoking, lack of physical activity, and uncontrolled diabetes can all contribute. Individuals with a known or diagnosed condition may benefit from secondary prevention measures by delaying the losses of a chronic progressive disease such as dementia and lessening the burden of the disease on the individual. These secondary prevention measures include increasing physical activity, eating healthier, quitting smoking, and ensuring diabetes is controlled. Individuals with Down syndrome are also at an elevated risk for cardiovascular disease and dementia due to their higher proportions of abdominal fat and obesity, increased risk of type 1 diabetes, and increased total cholesterol levels. Individuals living in the community have higher rates of cardiovascular disease than individuals in group homes due to greater lifestyle freedoms. They often consume more fast food and have a more sedentary lifestyle than those who live in group homes. Not all risk factors for dementia are preventable. These risk factors include age, genetics, family history, gender, and moderate or severe head injuries. Individuals with developmental disabilities are at an increased risk for dementia because of genetic factors, such as higher rates of associated disorders, social circumstances, for example, a lower income, a lack of access to the community, inadequate knowledge of health-promoting lifestyles, and inadequate access to health care and poor management of health conditions. An individual's baseline represents their normal or their day-to-day behaviors. Individuals with developmental disabilities may already have difficulties with speech, confusion, and memory, making it important to establish the individual's baseline. New and repeating changes from an individual's usual behavior can be an indication of early-stage dementia. There are 4 red flags of dementia. It is important to remember that these characteristics must be above an individual's baseline to be a potential indication of early-stage dementia. These 4 red flags are thinking, consisting of confusion or short-term memory loss. Behaviors, consisting of new behaviors or an increase in intensity, duration, or frequency of a previously existing behavior, for example, resisting assistance with daily personal care. Mood, such as increased sadness, frustration, or irritability. And finally, function, such as a decline in the individual's ability to physically care for themselves. The 8 guiding principles of dementia care are: 1. Know the signs. 2. Receive an early diagnosis. This allows individuals to receive information, support, and treatment at the earliest possible stage, lessening the burden of the disease. 3. Communicate sensitively in order to support meaningful interaction. 4. Continue to promote the individual's independence and encourage activity. 5. Recognize signs of distress for the individual and respond by diffusing a person's anxiety and supporting their understanding of the events they experience. 6. Family members and other caregivers are valued, respected, and supported to gain access to dementia care advice. 7. The company is responsible for training. Here at BeConnected, managers and the company take responsibility to ensure members of their team are trained and well supported. And 8, multi-agency teamwork is necessary in order to support persons with dementia. It is important to remember that only a physician can make a diagnosis of dementia. The process of seeking the uncertain dementia diagnosis is often a difficult and extended process, which can create anxiety for the individual, the family, and their support network. Although we cannot make medical decisions for the individuals we support, we can support them in other ways, such as assisting with communication, providing reassurance, information and clarification of the changes that have been noted. Encourage an open discussion of questions. Asking questions such as, "What do you think is wrong?" and "What would you like to know?" may encourage an open discussion of observations, questions, and fears. It is up to the individual's family and support network to decide whether to share the diagnosis with the individual or not. There is no right or wrong answer regarding this decision, and we must respect the family's wishes and the individual's privacy when it comes to sensitive information such as a dementia diagnosis. Depending on the symptoms, treatment may involve pharmacological and non-pharmacological strategies. Currently, little is known how cognitive enhancers treat dementia in individuals with developmental disabilities, therefore treatment is often variable. Non-pharmacological approaches should be the first line of treatment for behaviors associated with dementia. It is essential to begin planning to address future care needs as soon as possible. It is a process by which the individual and their families talk over their beliefs, values, and wishes for healthcare in advance of the time when they may be incapable of deciding and articulating for themselves. Capability to participate in this process is always presumed until it is ruled out. Before discussing what to expect in each stage of dementia, it is important to have an understanding of the types of health conditions experienced by people with disabilities. Associated health conditions are medical conditions which lead to the impairment of intellectual functioning, such as CP or Down syndrome. Comorbid health conditions are unrelated pathological or disease processes that have an adverse impact on health. High blood pressure and cancer are both comorbid health conditions, as neither of these are caused by an intellectual disability. Secondary health conditions are conditions that a person with a pre-existing disability experiences at a higher rate than the general population. These conditions may or may not be preventable. For example, recurrent pneumonia and pressure ulcers. The next section will go through the symptoms of each stage of dementia as well as how you can best support the individual. In the early stages of dementia, you should expect short-term memory loss, which can be variable and may result in a fluctuating ability to complete usual personal and functional tasks. The time of day, fatigue, and other distractions may be a factor. An increase in difficulty communicating, such as word searching and sentence fragmentation. Changes in mood or behavior, such as irritability, frustration, and anxiety. Fatigue and energy loss, sleep confusion can also occur. As a special note, individuals with Down syndrome may experience frontal lobe symptoms such as unexpected behavioral changes, increased impatience, and verbal and physical aggression in this early stage. These symptoms generally occur in the middle stage for the general population. In the early stages of dementia, the primary focus is to support the adult to stay at home safely and maintain their quality of life. It is helpful to create a quiet space for the individual with their important items. You should also provide them with quiet and repetitive activities such as folding laundry. You should change and adapt care routines to continue his or her usual lifestyle and daily activities. It is important to reduce your cognitive and physical expectations. Use subtasking, which involves breaking down a task into logical components which can be accomplished with simple verbal prompting or demonstration. We need to continue to involve the adult in the decision and choices about their care. In middle stage dementia, there are progressive declines in the domains of cognition, behavior, mood, and function. Personal care will require further subtasking, and some tasks may be fully provided for by others. Incontinence, assistance with nutrition and hydration, and an increase in choking are all common in the middle stage. Pre-existing epilepsy often worsens, and new onset seizures often occur in individuals with Down syndrome suffering from dementia. There is an increase in sensory impairment, particularly for vision and hearing, therefore movements are often slower and greater caution is used. In addition, common behavioral changes during this stage include verbal and physical aggression, such as yelling, pushing, and hitting, verbal and physical non-aggression, such as calling out, wandering, hoarding, and shadowing, resistance to care, and an increase in self-injurious behaviors. Common mood changes during this stage can include apathy, depression, and anxiety. Ways to support individuals with middle stage dementia are to meet the physical, emotional, and psychosocial needs of the individual that arises from increased dependency while ensuring dignity, comfort, and safety. Regular monitoring and comprehensive assessment of client needs using an interdisciplinary approach. This will help reduce, avoid, or catch complications and crises as early as possible. Timely attention to treatable conditions such as depression, anxiety, and sensory impairment can profoundly affect the individual's quality of life. Pay attention to comorbid and secondary health conditions. Behavioral modification approaches will often no longer work and may escalate behaviors. Caregivers will need to unlearn old ways and learn new techniques and strategies to accommodate and manage behavior. Keep all communications in the present and avoid giving nonverbal messages that may relay your own frustration. Be sensitive to space, avoid approaching the individual or contact too quickly, and check in with the support team to ensure care plan delivery meets the individual's expressed preferences if known. In late-stage dementia, you can expect most adults to no longer be able to communicate basic needs. They are often completely dependent for all personal care and mobility. Secondary or comorbid health conditions are commonly evident and may have worsened, resulting in complications and requiring closer medical management. This stage may mark multiple transitions such as hospital stays, move to a more suitable residential setting which can more fully support the individual. Although we try to age in place, this is not always achievable based on the individual's needs. In late-stage dementia, end-of-life decisions need to be made about the types of medical interventions the individual would want. You will need to pay attention to the dignity, comfort, and wishes of the individual. Pain and symptom management, as well as psychosocial, cultural, and spiritual supports are intensified in the final months and weeks. You will need to support the other residents who lived with the individual with dementia as they may experience anxiety, depression, or traumatic grief after the individual's passing. In summary, early intervention can lessen the burden of the disease on the individual. The dementia journey is variable as to the duration, intensity, and complications. Focus of care will shift as middle and late stages require more assistance. Care planning, plan supports, and multi-agency collaboration are important to promote the comfort, dignity, and well-being of the individual throughout the journey.